Hello students, you are welcome to Angel Health Academy. The topic for the day is differentiate between or differentiate in between NRHM and NUHM. So this is one of the most significant question in the university question paper. It was asked many times in differentiate between, that is NRHM and NUHM. In this video, I would like to discuss the difference between NRHM and NUHM in the examination point of view. The first feature is regarding expansion of NRHM and NUHM. So as you know, NRHM is expanded like a National Rural Health Mission and NUHM as a National Urban Health Mission. So National Rural Health Mission and NUHM as National Urban Health Mission. Both of these missions is a submission of National Health Mission. So both NRHM and NUHM are the submission of the mission of the National Health Mission. Second one is the launch. When it is launched in India, when it is started or when it is commenced, the commencement in India. NRHM launched in India on 1st April 2005. So National Rural Health Mission was launched on 1st April 2005 in India, and in case of National Urban Health Mission, it was launched on 1st May 2013. So National Urban Health Mission was launched on 1st May 2013. The third feature is aim and major services of NRHM and NUHM. So the aim of NRHM is to improve rural healthcare delivery system in India by providing equitable, affordable and quality comprehensive primary healthcare to the rural people. So the aim of NRHM is to improve rural healthcare delivery system in India by rendering or giving equal distribution of the health services, affordable at low or free of cost, and quality based comprehensive primary health care to the rural people. National Urban Health Mission is a separate mission for urban people, that is, it is concentrated only in urban area. So the main aim is to focus on urban slums and other urban poor people. So the main aim is it is focused on urban slums and other urban poor people by providing a need-based city-specific urban healthcare system for the urban people. So to provide a need-based, based on the need of the urban poor people, city-specific, that is, health services are depend upon the different cities and its problem. That is city-specific urban healthcare delivery system in India. The fourth one is the channel of service. The fourth feature is channel of service. Who are the most important person to render the both NRHM services and NUHM services? So for rendering NRHM services effectively, Government of India introduced or creation of ASHA, that is Accredited Social Health Activist. So one ASHA cover a population of 1000. So each ASHA worker cover a population of 1000. So for efficient rendering of National Rural Health Mission, Government of India started a new health personnel, that is the creation of ASHA, Accredited Social Health Activist, to render the NRHM services to the rural people at doorstep. So for every 1000 population in the rural area, there will be one ASHA worker to render the NRHM services. Then in case of National Urban Health Mission, that Government of India created USHA, that is Urban Social Health Activist, to render the health services to the urban poor people or urban slum people. Then one USHA worker will cover a population of 1000 to 2500. So for every 1000 to 2500 urban poor people, there will be one USHA worker. In short, one USHA worker cover 200 to 500 households or family. 200 to 500 households or family. So one USHA worker cover or responsible for 200 to 500 households or family in the urban slums and for the urban poor people. The next feature to differentiate, that is health agency involved in rendering NRHM and NUHM services. So NRHM services is mainly focused by the primary health center and community health center. So the NRHM services mainly focused by primary health center and community health center. Then in case of National Urban Health Mission, we have urban PHC and urban community health center UHC are present for rendering the NUHM health services for the urban slums or urban poor people. So NRHM services is rendered by health agencies such as primary health center and community health center, including sub-center under primary health center. And national urban health mission services are rendered by urban PHC and urban community health center. So Government of India upgraded PHC into urban PHC and community health center into urban community health center to render NUHM services for the urban slums and urban poor people. The last feature is special schemes and programs under NRHM and NUHM. So there are three most important schemes under NRHM, that is JSY, RKS and RSBY. So JSY is nothing but Janani Suraksha Yojana. It is the modification of the National Maternity Benefit Scheme. In this, cash assistance or benefits given to the mother during pregnancy and delivery, that is for the hospital delivery, and that is for the mother who belongs to, that is mother belongs to or mother comes under BPL, that is below poverty line. So the cash benefits given during the care of the antenatal period, during the intranatal period or during the delivery time, and after the delivery during the postnatal care or during the postnatal period. Then second one is RKS, that is Rogi Kalyan Samiti. This is the Hospital Welfare Committee or Hospital Welfare Society is formed to render the efficient patient care services in the hospital. So Rogi Kalyan Samiti is also known as Patient Welfare Committee. That is formation of a Patient Welfare Committee or a Hospital Management Society for the better hospital administration or better management of the patient services at hospital. Then last one is RSBY, that is Rashtriya Swasthya Bima Yojana. It is the health insurance scheme for the rural people, those who are comes under below poverty line. Then in relation to NUHM, there are different new schemes and project. First one is NRY, that is Nehru Rozgar Yojana. That is providing employment opportunity to the urban poor people, that is Nehru Rozgar Yojana. Second one is MAS, that is Mahila Arogya Samiti. It is a group of the 8 to 12 local resident women to form a Mahila Arogya Samiti to settle the problem of the poor urban women or poor urban slums. The next one is UBSP. UBSP is nothing but Urban Basic Services to Poor People. So poor urban people will be given urban basic services, which includes housing services, sanitary services, water supply services, etc. All comes under UBSP, that is Urban Basic Service for Poor. So the fourth scheme is SJSRY, that is Swarna Jayanti Shahari Rozgar Yojana. So it is also one of the employment scheme for the urban poor people, in which government will give the central government will give the subsidy to start the or setting up of the small scale self-employment ventures. To start the small scale self-employment ventures, government provide the subsidy for the urban poor people under Swarna Jayanti Shahari Rozgar Yojana. So today we have discussed about the major difference between NRHM and NUHM in the examination point of view, with the feature of expansion of NRHM and NUHM when it started launch. Then aim and service, the important channel of service of NRHM, that is NRHM by Accredited Social Health Activist is ASHA, NUHM by USHA, that is Urban Social Health Activist. Then we have discussed about the another feature of health agency involved for NRHM, that is PHC and CHC, and for NUHM, that is Urban PHC and Urban CHC. Then sixth feature is special schemes and programs under NRHM and NUHM. Under NRHM it is Janani Suraksha Yojana, RKS Rogi Kalyan Samiti, and RSBY, that is Rashtriya Swasthya Bima Yojana. Under NUHM it is NRY, that is Nehru Rozgar Yojana, MAS, that is Mahila Arogya Samiti, UBSP, that is Urban Basic Service for Poor, and SJSRY, that is Swarna Jayanti Shahari Rozgar Yojana. So thanks for watching. Hope this video really benefits in your studies and exam purpose. And if you feel it is really worth and beneficial, please like, share and subscribe my channel, and stay tuned with the Angel Health Academy for the another educational video. Thank you.